So you have a patient with conversion disorder. Well, here are some things you should know. Conversion disorder is classified in the DSM-5 as a somatoform disorder. Somatoform disorders exhibit some form of physical symptoms that cannot be explained by medical or neurological condition. An individual with conversion disorder may present with sensory and/or motor deficits, such as paralysis, which cannot be explained by a general medical condition. The cause of conversion disorder is not well understood, though there seems to be a link between previous psychological trauma and the onset of conversion disorder symptoms. Psychoanalytic theory postulates an individual with conversion disorder has experienced an internal conflict when this intolerable trauma or stress becomes unconsciously converted into physical symptoms. Common motor symptoms include weakness or paralysis, abnormal movement, aphasia, ataxia, aphonia, seizures, swallowing symptoms, and speech symptoms. Sensory symptoms include visual, olfactory, hearing, and/or balance disturbances, as well as anesthesia, paresthesia, or sensory loss. Though there is no gold standard for treatment, options include psychoanalytic psychotherapy, cognitive behavioral therapy, biofeedback, meditation, relaxation, transcranial magnetic stimulation, and hypnosis. As an OT, you want to know how this will affect occupational performance and engagement. Within the CMOP-E, conversion disorder can affect various aspects of the person. Quite obviously, the physical performance component will be affected due to these sensory and/or motor symptoms. Affectively, comorbidity with other mental disorders such as depression and anxiety is very common. Individuals often may have difficulty accepting nothing is physically wrong with them in the presence of physical symptoms. As well, perceptions of doubt from professionals, friends, and family can lead to feelings of distress and isolation. Conversion disorder can significantly impact a person's quality of life and is associated with significant disability. The person may have a sense of loss of identity, especially if they are unable to engage in their meaningful occupations. At the institutional level, those with conversion disorder may be met by doubt or negative attitudes from professionals in the healthcare setting. In fact, it has been found negative attitudes towards individuals with conversion disorders were common among neurology wards. Conversion disorder symptoms can also influence the occupations in which a person is able to engage. The severity and specific areas of impact will vary based on the unique symptoms of the individual. Conversion disorder can affect a variety of self-care occupations such as bathing, dressing, eating, toileting, grooming, or functional mobility due to their altered motor and/or sensory function. Conversion disorder is commonly diagnosed in adolescents and can have a significant impact on school engagement. In adults, conversion disorder may limit a person's engagement in work, and somatic disorders are a frequent cause of employee sick leave. The treatment and rehabilitation process can also remove individuals from work or school and can have a large impact on productivity. Motor and sensory deficits and the treatment process can also impact an individual's ability to engage in leisure activities. Common comorbid mental disorders such as anxiety and depression may further limit an individual's ability and motivation to engage in leisure occupations. Now let's look at how you, the OT, can help. As an OT, some CMCE skills you are particularly likely to utilize include educate on the condition, ways to re-engage in occupations, and on available supports and assistive devices. Coach, assess strengths, choose goals, and provide feedback, and consult with other healthcare professionals including physicians, nurses, psychiatrists, psychologists, PTs, SLPs, etc. Occupational therapists play an important role bringing a different perspective to the team and utilizing holistic treatment approaches and client-centered care. Of the treatments mentioned, OTs can utilize CBT, biofeedback, meditation, relaxation, and would also probably be involved in basic and instrumental ADL education. It is important to keep in mind that patients often have a challenging time accepting or understanding there's nothing physically wrong with them, although they are presenting with a variety of physical symptoms. This makes it very important to develop a strong therapeutic relationship with your patient. The holistic perspective of OTs make them well suited to treat this condition that presents as a physical disorder but is ultimately a mental condition.